Cool. Sure.
Hello and good afternoon, Dr. Rahul and Vicky. How are you guys today?
Doing good, thanks.
You're good. Thank you very much. How are you, Bob?
I'm really well. Thank you so much for asking. And thank you everyone for joining us on our webinar today, Beyond Automation, How AI is Transforming Utilization Management. So welcome everyone. I'm Bob Sharma and I'll be your moderator for today's discussion. I'm joined by two wonderful experts, Dr. Rahul Dalvi, who brings the practicing physician's perspective, someone who faces operational and emotional realities of utilization management every day. Vicky Kumar, who is our digital transformation specialist with deep experience applying AI to streamline clinical and administrative workflows in hospitals. Today, we're exploring how AI is reshaping utilization management, or far beyond traditional automation. We'll start with the persistent challenges in move through the limits of older systems, and see how AI now brings insight, context, and speed to the process. We'll also walk through real case studies and practical lessons shaping the future of healthcare operations in 2025. As we begin, I want you to reflect on your own organization. What's the biggest bottleneck you face? Is it payer delays, inconsistent documentation, or denials that feel arbitrary? Keep that top of mind as we go, because by the end of this session, you'll see how AI can do more than automate. It can empower. Now let us begin by looking at why this matters. Healthcare is undergoing a fundamental shift. Declining payouts, increasing operational costs, and growing regulatory demands are forcing organizations to rethink how care is managed. AI is not just transforming utilization management, it is redefining how payers and providers improve efficiency, accuracy, and decision-making across the entire revenue and care cycle. Let's move on to our next slide. For evolving market pressures and driving AI adoption, I would like to invite Vicky Kumar to tell us more about this.
Thank you very much, Bob, and good afternoon, everyone. And thanks so much for joining this session. So we are going to talk about how the evolving market pressure driving AI adoption. Across healthcare, we are seeing strong market pressures that are accelerating the need for AI-driven solutions. And it is being impacted, the entire healthcare system is being impacted with that, but especially the providers, they are struggling with workforce shortages and sharp rise in operating cost, which was up nearly 16% in 2024. This strain directly impacts productivity and the patient care. If we will talk about the administrative burden, it continues to grow. Over the next 2 years, payers are expected to spend over 14 million and providers about 54 million just to meet compliance and process requirements. That is a huge financial weight on an already overworked system. And if we will talk about the impact, which is not impacting only the providers or the administration, it is also impacting the payers. Payers are already experiencing mounting financial pressure, with margins shrinking sharply and liquidity tightening due to rising medical cost, delayed reimbursement, and growing compliance demand. All of these factors are creating an environment of financial strain, operational inefficiencies, forcing organizations to rethink how they manage the documentation, authorization, and coding. And to add to that, new regulatory mandates are changing the landscape as well. All of this combined makes one thing clear for all of us: AI is no longer optional. It is now the key to building a more efficient, compliant, and sustainable healthcare system. That would be all. Thank you very much, Bob.
Thank you so much for that, Vicky. Moving on to our next slide, we'll be talking about the real-world challenges of utilization management. Dr. Dalby would shed some light on this one.
Good afternoon, everyone. I'm Rahul Dalvi, and I am a physician trained in internal medicine, and I've been practicing internal medicine and hospitalist work for over 15 years now. And I've also had the privilege of seeing the other side of medicine, which is revenue cycle. So I'm a medical director at a tertiary care hospital here in Northeast Florida, and I manage revenue cycle, I manage utilization management, as well as denials for a large hospital. So I just have a unique perspective because clinicians are either on the clinical side or they're on the management side, but I've kind of had dual roles for a long time. And so we want to first look at what are the challenges that are facing us right now, especially in utilization management and revenue cycle as a whole. And then we can look at, what is AI going to bring to the table for us? So starting with revenue cycles, the first and foremost, the big one for all the hospitals is denials, because denials is where hospitals leak money left and right. So a lot of times prior authorizations are required for most of the procedures now, and that is a pain point for the hospitals. The second big one in revenue cycle is documentation and coding. And why it's a big one? Because physicians like myself, we were never trained in medical school to document how it impacts coding. So coding language is completely different. What we document on the chart for patients is completely different. And those two don't always talk to each other. And so that's a pain point. And then you have technology, and technology is great, but if it's not integrated, if you have different platforms for EHR, if you have a different platform for billing and coding, then those don't talk to each other, and that creates problems. And staffing issues, I don't have to say a whole lot. Staffing issues are everywhere across US. Now we want to change gears a little bit and look at what do we have in terms of the clinical workflow and what are the challenges associated with that. So first and foremost, as a physician, EHR is great. Before I used to write everything on paper. Now I document everything digitally or on a computer, which is great for me. But at the same time, what has happened is I'm spending less and less time with the patients and more time in front of the computer, clicking, typing, doing all those things that someone else should really do. My time is more important, and that's spent more with the patient is what we really want. So that's kind of taken away from our EHRs. Medications, a lot of errors in medication management. We all know it's all a manual process right now. The third thing is capacity and patient flow. And why capacity is important? Because if you go to any ER right now, if you step into any US ER, you'll see the ER is full of people. The ICUs are full. Why? Because we don't manage patients the way we should in the hospital. They're not managed in the adequate level of care. They wait for hours, sometimes days to get into ICUs. They wait to get discharged. We don't do anything from a predictive point of view. Everything is sort of retrospective for us. And that is why nurses are overworked. There's clinical overload for a lot of people working in the hospital. So now we come to the most interesting and the most frustrating part of healthcare. And that is, how do we make the clinical world, the doctor and nurses world, meet revenue cycle, which is your billing, coding, reimbursement. Again, documentation, big gaps there. Our documentation doesn't talk to the coding world, and we can't code and bill everything that we can. I want to give you an example. In a hospital, every single day, there are charges that are just not captured anywhere in the billing cycle. That was a shock to me when I saw that. If a surgeon comes to a patient and does a bedside procedure and doesn't document it well, that may not get captured in the billing, and we lose money left and right for that. And a lot of times hospitals will lose about 2 to 3% of their margin annually just by charges not being captured. So that's a big problem. And then we look at data. Data is everywhere, but data has a lot of silos right now. Our clinical information is in the EHRs. The insurance companies have their own contracts that are in some binder somewhere in their office. You got billing software, which is different from clinical software, and the data just doesn't talk to each other. And so the physicians are left with not knowing exactly what to document, how to code, et cetera, et cetera. So these are some of the big challenges in UM. And next, I'm going to talk about some specific issues and limitations of utilization management. I'm going to take you to what it looks like for a UM nurse on a day-to-day basis. So when a UM nurse comes into work in the morning, she has about 40, 50 patients that were admitted the night before that she has to look at. She has to go through every single chart manually. She has to look through all the patient care notes, all the studies that have been done on the patient, all the labs, radiology, all of that. And all of that is still manual in this day and age. Go figure. I don't know why, but it is still manual. And obviously when it's manual, it is super time consuming. So the nurse spends 30, 40, 50 minutes of her time every single day reviewing charts. And then what that brings? That brings a lot of error, because when you have a human that is doing all these things, there is a chance of error, because not two human beings will do one thing in the same way. They do it their own way, as we all know. And then the third thing is, are we doing anything in real time? When a patient comes to the hospital, are the reviews being done in real time while the patient is being admitted to the hospital? No, they're not. They're being done 24 hours, 48 hours later. Sometimes they're done after the patient is discharged. What that does is insurance companies don't get anything on time, and so they send us a denial after that patient is discharged. And when the physician is faced with that denial, they have no clue, because that patient has gone home 4 days ago and they don't have a recollection of what happened with that patient 4 days ago. So it's hard for them to keep a track. So there's nothing real time that's happening. And then you got fragmented data that we talked about, a lot of communication gaps, and then a reactive approach. Entire utilization management is all reactive. We do reviews after the fact. We code after the patient is discharged. We bill after the patient is discharged. Nothing is happening while the patient is still admitted to the hospital, or when that physician is actually sitting with that patient. We want everything in real time, and we'll talk about how we can make that happen. And then last but not the least, inconsistent decision making. Like I said before, when you have humans that are doing everything in their own humanly way, you're going to have errors and you're going to have inconsistencies. That is what is happening. Physicians are trained in a good way in medical schools and residencies, but each physician has their own way of documenting, treating patients, looking at things their own way. And the insurance companies have one contract for everybody. So that's where we drop the ball a lot of times. There's no uniform documentation, a lot of inconsistencies in the system. And we're going to look at next, what is AI going to bring to the table? And Vic is going to give us a little bit of insight. Actually, yeah, Vic is going to give us a little bit of insight into what sort of solutions can we look at in the future.
Thank you. Thank you so much, Dr. Rahul, for sharing the insight about the current challenges. So, Talisman being there with working with a lot of healthcare partners since 2004. We have done a lot of research, and now since we have already talked about what is driving the AI adoption, let us look at how Talisman is addressing these challenges through a focused and practical suite of AI powered solutions. So considering the challenges that we have right now, each solution is built to simplify healthcare operations, which essentially reducing the manual effort, improving compliance, and ensuring greater accuracy across documentation, coding, and authorization workflow. So we have the AI ARM tool, the automated review management. It integrates seamlessly with any clinical hospital or hospital software to automate the documentation review process. It identifies missing payer reimbursement, flag high risk or critical claims, and applies predictive scoring access when it comes to billing and reimbursement. The system also supports sustainable paperless operation through intelligent digital workflow optimization. And then we have the interactive dashboard, which capture the essential KPI, which is required to run any healthcare system successfully. Then we'll talk about the AI coding, which enhances the coding accuracy and comply with the automatically validating documentation and mapping the correct code. This reduces claim error and accelerate reimbursements, helping both providers and the payers achieve greater operation efficiency. So AI coding is essentially review the charts, it shows it check the notes and applies the appropriate code automatically. And then we have the AI soap notes. Many of the providers still using the traditional soap notes method, in which there is the process is very time consuming. So capturing the live our soap notes capture the live provider and patient interaction. It instantly converting them into structure audit ready soap notes. It integrates seamlessly with clinical software, enabling automatic attachment of documentation to patient charts or to their account. This reduces manual entry, enhances accuracy, and allows clinicians to focus more on patient care rather than administrative tasks. And it all helps making a valuable decision through our AI workshop. So it is a complimentary hands-on session we offer to the healthcare organization to explore how AI can address their specific operational challenges. Our team analyzes real practice or hospital data. We collaborate with their staff and demonstrate how automation can improve documentation accuracy, reduce turnaround times, and optimize overall efficiency. It is a practical way to the client to see AI impact in action before implementation. Together, all these solutions reflect Talisman's edge and approach, practical data driven and aligned with hospital involving needs, helping our organizations achieve consistency, compliance, and efficiency at a scale. Uh, we are going to talk about more on transforming the economics on the next slide. All right, so with the solution and the help of AI, how it is transforming the economics of healthcare operations. So as we move deeper into the digital era, the economics of healthcare operations are being fundamentally reshaped by artificial intelligence. Our data shows that automation delivers measurable and sustainable result, with a 60% reduction in claim review times, a 40% improvement in coder productivity, and a 22% decrease in prior authorization and denials. These are not just incremental gains, they directly translate into improved cash flow, faster reimbursement, and more efficient use to workforce resources. And at the same time, if we'll talk about the impact on the operational side, we are seeing a 15 to 30% boost in overall productivity across back office function, saving an average of 30 to 35 hours per week per team. This is why nearly half of the hospital, about 46%, have already adopted some form of AI in their revenue cycle management workflows. And the market is reflecting the shift. The global healthcare AI market valued at 26.7 billion in 2024, and it's projected to reach 187 billion by 2030, growing at a compound annual rate of 24%. So if I have to sum up these, so I would say that these numbers clearly demonstrate that AI is no longer a future version. It is an operational reality driving both efficiency and financial resilience across healthcare system. So back to you, Bob. Thank you.
Thank you so much for that, Vicky. Now we're going to move forward and talk about evolution of technology in utilization management. The story of technology mirrors healthcare's digital evolution as a whole. It started with paper workflows, moved to electronic systems, and eventually added rule based automation. Each phase improved efficiency, but none added intelligence. Automation accelerates, but it doesn't adapt. It can process repeated forms flawlessly, but if the documentation language changes or a new pair rule appears, humans have to step back in. That rigidity drains productivity. AI, on the other hand, learns patterns from experience. Modern AI systems can review lengthy case files, identify relevant excerpts, and even cross check those notes against pair criteria in real time. Instead of humans hunting for information, AI surfaces what matters. That shift from processing to understanding is the inflection point we're living through today. Hospitals using this approach have reported 60 to 70% faster case resolutions with fewer errors. AI is turning from a static checkpoint into a dynamic partner in decision making. Moving on to our next slide, we're going to talk about the role of AI in utilization management. And who better to tell us about this more than Dr. Rahul Dal?
Thank you, Bob. So Bob just told us about, where AI is taking us. And that was more of a 1,000-foot view of what it looks like for us to have AI implemented in our workplace. So I'm going to focus a little bit on something that we have developed here at Talisman, and something that is really going to revolutionize how we do work in and how we do work in revenue cycle in general. So first and foremost, what AI is bringing to the table for us is intelligent automation. And you all know we've had basic automation for a long time. It's been around since the 80s. Okay. My hospital, we've got a lot of things automated, but it's not something that has a mind of its own. Intelligent automation is something where AI will take over the role of a human being almost, and then deliver something that we can work with as if a human being has delivered it for us. And that human being obviously is a doctor or nurse. So when you look at AI, it adds reasoning and it adds context beyond our traditional automation. And I'm going to just kind of walk you through how it does that, like a real life patient scenario. So when you have a patient, for example, that is coming into the ER, right now, like I said, the doctors admit patient, the nurses take care of the patient on the floor, but there is nothing else that is happening that is automated for us right now. Everything is manual. So with this platform, we're going to have AI tool that is going to look at that chart comprehensively. They're going to look at the patient's past medical history. They're going to look at the AI looks at what is the patient presenting with right now? What is the diagnosis that could be assigned to that patient? What sort of a treatment plan that can be generated on that patient? And then above all, it's also going to apply criteria for inpatient versus observation. So it not only creates a clinical plan for that patient, but it also determines eligibility for our insurance companies, whether they will approve that case or deny that case. And it does this by reading through the entire chart by natural language processing. And it's a miracle, almost a miracle, because it's going to go ahead and extract all the important and relevant clinical information that a doctor or a nurse would be able to do, but it would take them hours and hours of their time. Instead, AI does that in an instant and gives us that output in an instant when we need it. So it could be done at the time of admission, 24 hours later, 48 hours later, whenever we want it, it's right there for us. The third thing is predictive modeling, and I talked about that a little bit, is how do we utilize AI for predictive modeling? Right now, we just admit patients, we treat them, we discharge them, and then after the fact, we look at what did we do wrong? Did we document adequately? Did we do things that we were supposed to? With predictive modeling, we will identify all the high-risk cases from the get-go. If a case is high risk for a denial, we'll know it upfront. If the patient is exceeding the length of stay, we will know that upfront so that we can have care managers working on it and getting the patient through the system fast enough. The next one is real-time mapping, and that's one of my pet peeves. Is right now we don't do anything real time, but with this platform, AI is going to look at patients constantly. Like it doesn't stop. Like a doctor would look at a patient and then move on to the next patient. AI can stay on that patient, and when there is a change in that patient's clinical condition, for example, if a patient came in with chest pain, and then 2 hours later, their troponin came back, and now they're having a heart attack, AI would be able to catch that right then in real time, and then update the summary in real time, which is tremendously helpful because not a nurse and a doctor is not checking on that patient constantly, but AI will help them know that yes, a change has occurred on that patient. And also with insurance companies, if an insurance company changes its contractual language, then we can feed that into AI, and then AI can look at the criteria at the same time. And what that does is that reduces the number of denials in the long run. And we're going to talk a little bit about denials later on. But the other thing that AI is going to do for us is decision support. And what that is help nurses and physicians at the point of care, not afterwards, but at the point of care, when they're taking care of that patient, AI will aid a doctor or a nurse to understand which patient has what documentation, which patient meets criteria, and whether a particular patient should be admitted to inpatient or observation. A lot of doctors have no clue. When I started after my residency and I was admitting patients, I had no clue which patient meets criteria, which patient doesn't. I was just kind of lost. And still a lot of doctors are lost because they're just making these decisions in an arbitrary way without a whole lot of logic or sense behind it. But AI will put that logic and sense for the doctors. So that's what our platform is going to bring to the table is complete intelligent automation. Next.
Thank you so much for that, Dr. Dalby. Now, as we speak about the benefits of AI in UM, whenever AI enters UM, the benefits start showing fast, operationally, financially, and clinically. Operationally, it collapses turnaround times from days to hours. What once took a review team 2 days can now be completed in an afternoon. Administrative costs drop as repetitive tasks are automated, freeing staff for higher value work. From a clinician's perspective, this feels liberating. Less administrative back and forth, fewer redundant entries, and quicker feedback loops. And the patient experience dramatically improved. No one likes waiting for an approval that holds their treatment hostage. In one hospital that adopted AI based authorization management, approval times decreased by up to 70%, unlocking over 1,000 clinician hours per year for direct care. And that's not unique. These outcomes are consistent across many AI deployments worldwide. At a scale, this means a better flow of care, reduced burnout, and measurable financial gains. Next up, Dr. Dalby, if you could tell us about a case study of or example of this.
Sure. So this is the most interesting part for me. Uh, I deal with this day in and day out in the hospital system that I work at. So this is not my hospital, but this is one of the hospitals, and we're just taking this one as an example. So let's say this is a 500-bed hospital, which is a little bit bigger than your average US hospital, but any tertiary care center would be about 500 beds. So we've got this hospital, we've got patients that are being admitted to the hospitals, taken care of, being discharged. And for a hospital this size, I would anticipate that they admit close to 100 patients a day, 100 patients for medicine, including surgery, OBGYN, and all of that. And then these admissions are weighed against criteria for inpatient, which are MCG or interqual. And then they're looked at by utilization management nurses and UR physicians, and then decisions are made who should be inpatient, who should be observation, and things like that. But what is happening right now is the problem. The problem is everything is manual. So we look at these patients, we try to get to them every single day, but the nurses really can't do all 100 reviews every. So a lot to get to some patients. Some patients are looked at 2 days later, 4 days later, sometimes after discharge. And by the time we look at them, we create summaries, we send them to insurance companies, we're already getting denied on all these patients. Oh, excuse me, I think it's my phone. All right. So where was I? So I was talking about, what the situation is right now. So we're getting denials on a lot of these patients. And if you look at what's the percentage of denials currently, it's close to 15%. The 12% on the slide, that's a little more on the conservative side, but we see close to 15 to 20% denial rate, which means that almost 1 out of every 5 patients that we take care of in the hospital, we don't get a dime on that patient, on those patients. And that is a big revenue leak for the hospitals. It's not good for the CEOs, the C-suite, the doctors, anybody, because if you don't have margin, you don't have mission, right? That's what we're taught. So losing that much money is a big, big red flag for us. And that translates close to 10 to $20 million a year, and sometimes even more. If you look at surgical cases, that number is close to $20 million a year. And that is the money that the hospital should easily get, that they're just losing for no big reason, for the reason that we are all manual and not automated in any way. And then one of the biggest after effects of that is the physicians are frustrated and burned out. Why? Because, I'm a physician, I'm working with my patients, and a nurse comes to me and says, hey, you got to go do this peer-to-peer call with this insurance company. And I'm like, on what patient? And she's like, the patient you discharged 4 days ago. I'm like, that's not what I want to do right now. I want to take care of the patients that are in the hospital. So the physicians are burned out, the nurses are burned out, billers, coders, everybody is just hanging their head on how inefficient the system is. So this is the problem. So next we'll look at what do we have that we've created that is really going to solve this problem in real time. Okay? And that for everyone is our AI solution. It is the AI-powered concurrent review system, a platform that we created to address all the issues that we've talked about so far. And I'm going to tell you how that works. So right now, we've got this solution that screens every single admission from the get-go. Okay? And it can also be utilized in clinic settings where the patients are being seen in the clinic. But right now, we've got it configured to a hospital system. So every patient is screened by AI, by this platform, and a decision is made because that screening includes payer-specific criteria. So for example, let's say we've got a patient that has United Health Insurance. Okay? United has certain criteria. AI will automatically screen that patient, see if the documentation that the patient has supports United criteria. If it does support the criteria, it's going to turn green. It's going to go as a claim. No questions asked. It's as smooth as that. But if that patient doesn't have the documentation, or if they're on the fence, if they're yellow, we'll call them yellow. If they're on the fence, they don't meet documentation, they don't meet criteria, then at that point, they're going to be reviewed by a human, like a nurse or a physician, and then they're going to put the documentation in, screen for the criteria again, and then once it meets, then it will go to the insurance company. So there'll be a second level scrutiny on these yellow patients. And then you will have patients that are admitted to the hospital but don't have the documentation, are not sick, don't meet criteria. Those are patients that should have been observation. They should not have been admitted to begin with. And AI is going to screen those and let the nurse and the physician know that, hey, look, these need an observation order. Don't make them inpatient. And that would be done in real time while the patient is being admitted or still in the hospital. So that will essentially eliminate all denials that we talked about, because you have a system that is foolproof. It is consistent, it is intelligent, and it's proactive, and it's scalable, because AI can look at 500 patients in one instance. It doesn't have to spend 500 hours scanning all those patients. You click a button, do one click, and it'll scan the whole chart for you. Okay, that's the miracle of AI and the platform that we've created, and the results are right in front of you. Okay, so we're looking at a 6-month implementation, not a 6-month implementation, results after 6 months of going live, for example. It's going to take probably a couple of months of getting the IT team involved, getting the team, the revenue cycle team involved in implementing something like this. But once it's done, the results will speak for itself. You'll have a denial rate that was close to 15-20%. That is going to drop down to 3 to 5%. Okay, that is huge amount of savings. That savings of close to $10 to $20 million a year as a conservative estimate. Okay, it's usually way more, because when you look at surgical cases, we look at cardiac surgeries, things like that. That is way more. Each surgery is probably $1 million, so you can do the math on that one. And that, not just that, the average time of these reviews, which used to take 30 to 35 hours, Vicky mentioned that in one of his slides, as how long those reviews take. Those drop down to instantly at the time of admission or within 4 hours after admission. So that's a big boon. And what that does, that gives time for our nurses and our physicians and everyone else who is looking at these charts to focus more on what is value added, which is taking care of the patients, quality care, safety of the patients, and all the redundant work, the repetitive work is all done by AI in the background. It doesn't take away work from the nurses. We don't have to cut nursing power. We don't have to cut physician power. All we're doing is we are making them way more efficient than what they were before, so that they can focus on the real clinical problems rather than clicking on a computer and looking at charts. So that's your big aha moment where AI is transforming every manual, retrospective, inconsistent process into something that's intelligent, something that's proactive, and something that, again, is scalable to a large extent. So I couldn't be more excited about this than any of you. So, Bob?
Thank you so much for that, Dr. Rahul. Moving on to our next slide now. Vicky, if you could just share or address some key concerns in AI adoption today.
Sure, Bob, and thank you so much, Dr. Delvi, for sharing the benefits of AI and what it can do. But since we have talked about the benefits of AI, the automation, predictive modeling, real-time mapping, I know that it all sounds great, but no technology decision is complete without addressing the concerns. And AI in healthcare deserves careful governance. So if I talk about the data privacy, AI system in utilization management must fully comply with HIPAA and GDPR and other regional privacy standards. AI system, the modern platform use encryption, anonymization, and role-based access to ensure patient information never leave the secure environments. And we all know that sometimes accidentally the algorithm learn the bias if trained on unbalanced data sets. That's why responsible AI system undergo continuous retraining and independent audit to maintain fairness and opportunity. And we have already talked about the human oversight or human error. AI should never replace clinical judgment. It should support it, but I would say that final approval always remain with the qualified professionals. And clinician must see the reasoning behind every AI recommendation. When AI systems are open, auditable, and safe, they move from being questioned to being trusted partner for every healthcare system. And the best organization today are already aligning with these responsible AI frameworks to ensure that innovation and integrity move hand to hand. Bob?
Thank you so much for that, Vicky. Now, moving on to our next slide, what's next? We're moving towards proactive instead of reacting to denials. AI will prevent them. Integrated systems will predict risks, recommend optimized care plans, and sync in real time with payer databases and EHRs. Newer models like generative AI based assistants will summarize case histories, write draft justifications, or identify documentation gaps automatically. will feel less like an administrative layer and more like a continuous clinical support system. Bringing is this all together. AI isn't a futuristic promise for it's a present day reality, reshaping hospital operations. We've seen how traditional systems created inefficiencies, how automation helped but couldn't think, and how AI now bridges that gap with understanding, speed, and intelligence. The future of utilization management is not about removing humans, it's about elevating them. When technology handles the routine, clinicians can focus on patients and not paperwork. So here's the call to action: identify one process in your organization that causes the most authorization friction. Ask, what if AI handled 70% of this? Because in 2025, that's not a pilot project, it's a standard practice. Let's move on to some Q&A now. If anybody has any questions, we'll be more than happy to answer them for you. All right, so we have our first question coming up, and this is by Mr. Puneet, and he wants to know, is AI able to handle all scenarios, or human in the loop is required to ensure 100% accuracy and reliability?
You want me to take that?
Sure.
Sure.
Sure. All right. So the answer is yes and no. So AI can do a lot for us, but like you said, yes, we have to have a human in the loop somewhere. I would say that I showed you guys about how our platform works and how cases will be green, or yellow or red. So I would say if an account or a case is green, where you have documentation, you have criteria that is met, all of it is perfect, then those cases will not need a human in the loop. They would go straight out the door to the insurance companies, get billed, everything will be good because they've already been looked at by a physician and nurse on the floor. But the ones that are complex and the ones that require a certain amount of scrutiny, where the documentation is not adequate or they're not meeting criteria, and then those are the ones where we will need a human in the loop. So we won't really get rid of the physician advisor or the nurse per se, but their efficiency is going to go up through the roof because they will only be working to the maximum ability of their license. They won't be doing any redundant, repetitive work that AI will be doing for them. So to answer your question, for the most part, AI should be good to um, take care of cases for billing and prevent denials. But for some, we will always need a human in the loop.
Thank you so much for that, Dr. Dalby. I have another question from Rizwan. How can smaller hospitals or clinics with limited IT budgets realistically begin integrating AI into their utilization management process?
Well, I can try to answer that. So, well, thank you
Sure.
so much, and it is a really important question. So, uh, we know that there are a lot of practices, individual providers. So, I would say that in this scenario, we should start small with modular AI tools, which can be easily integrated into existing systems. Use cloud subscription models for affordability and gradual implementation. So while the business grows, they can adopt for more bigger AI versions. But yes, at the beginning, I think that is the most important part. If that answers the question, thank you.
Yeah, and I would just
Thank
add
you
to
so much for
that,
that.
um,
Sure.
like Vicky said, start small and with a clear high ROI. Um, I would say small hospitals can at least do a pilot implementation of a project like this to see if it works for them. And if it does work for them, then they can go full scale and deploy their entire organization and see the benefits. But just doing a pilot implementation would give them enough opportunity to evaluate the platform and see for themselves what the benefits are.
Perfect. So we have another question over here by Deepak. He wants to know, when implementing AI in utilization management, how do organizations ensure patient data remains secure and compliant with HIPAA and GDPR?
That is a really good question. And that is the question on everybody's mind when they're implementing any new project, be it IT, be it clinical, be it quality, because the number one concern that everybody has in healthcare setting is data privacy, compliance, and making sure that everything is HIPAA compliant. Because if you step outside of that, you're going to be in big trouble. So our tool uses encryption. It uses anonymization and then role-based access. So not everybody in the organization is going to be privy to every patient data. It's going to be based on what their extent of involvement is in the project. So, and we will partner with HIPAA and GDPR compliant vendors that ensure that there is consent-based handling of data all the time. So that data will not go in the hands of anybody outside of all HIPAA compliant vendors that we will employ.
Thank you for that answer, Dr. Dalby. We have Manoj asking, how do AI systems handle incomplete or ambiguous clinical documentation? I can answer that for you, Manoj. So AI uses NLP and context reasoning to identify gaps or unclear entries, flagging them for human review to enhance accuracy. So that's how it's done. We have another one from Rohit. If AI can predict prior authorization outcomes, how much control should still remain with human reviewers?
I can try to answer that, Bob.
Sure.
So, I believe human oversight is essential. AI assists with insights, but like we already talked about this, right? Clinicians retain accountability for ethical and safety reasons. Like Dr. Telvi has also pointed that out, that if you go outside of the framework when it comes to compliance and privacy, you will be in a very big trouble. So yes, of course, uh, professional care is always should always be there in this scenario.
Right. Thank you so much for that answer, Vicky. One more question we have from Vineet. He wants to know, how can hospitals build trust among clinicians and staff toward AI-driven systems?
That is a really good question, and that just brings us to basics of, how we do business. I mean, we want to do business with transparency, with AI that we can explain. If when we get results from our AI platform, we should be able to explain those results. We should have audit trails because everything in this day and age is auditable, and we want to make sure that we always stay compliant with Medicare, Medicaid, with insurance company contracts and such. And so once we establish that okay, we will always do everything that's kosher and not step out of guidelines and step out of policies and step out of regulations with Medicare and Medicaid, it is easy to explain that, okay, we're going to build the trust with our vendors and the hospitals and the payers alike. So I think it's transparency and it's making sure we have strong audit trails to drive that.
So we have one more question from Sharad, and a very important question. What key metrics should organizations track to measure AI's impact in So track turnaround time, denial rates, accuracy, clinician time saved, and patient satisfaction to gauge holistic improvement. So these are your key metrics over here, Sharad. Oh, we have one more popping up over here. What are common pitfalls when deploying AI in for the first time?
Oh, well, I can answer that. So I think we have already we have already talked about the poor data balance, right? So pitfalls include the quality of the data, low clinician engagement, over resilience on AI, and neglecting workflow alignment. All that actually impact to this scenario. So we need to be very careful with that.
Yeah, and I can't agree more. I mean, we need buy-in from the clinicians to begin a project like this. Because if you don't have the doctors and the nurses that are the backbone of any healthcare organization on your side, then you don't have anything. And it's up to the leadership of hospitals and clinics where they can engage the physicians, they can engage the nurses, and just really show them how much AI is going to bring efficiency to the table. I mean, as a physician, the two things that I want is I want to take good care of my patients. I want to spend as much time as possible with my patients. And then I want the rest of the time for myself where I can go play golf or do something else. I don't want to be sitting in front of a computer um, being a data entry clerk, and that is what
Correct. Yeah.
AI will do for us. Once you show the physicians and nurses that that's what AI does for you, it doesn't take away your role or doesn't negate what you're doing, then you automatically get a strong buy-in. And once you get that, it's an easy implementation.
Right. So we have a question from Sumit. He wants to know, can AI automatically adapt to changing payer rules and regulations?
Actually, the answer is yes. And that is actually one of the exciting features of AI because it is very adaptable to however you want to program it, if you will. Okay, so AI uses continuous learning and APIs for updates. So it will constantly scan patients' charts for updates in real time. It will scan the literature to see what is the latest literature that applies to that patient in terms of the treatment guidelines, in terms of the predictive value of their length of stay and such. And it will also adapt to changing payer guidelines, which means that let's say United Insurance or Humana change their guidelines or change their criteria tomorrow, then we can always configure AI to make sure that the AI captures those, and then the cases are automatically weighed against those guidelines so that there is a clear operability between the two, between the hospital and the payer.
Thanks so much for the doctor. So we're going to go with our last question over here by Sajal. How does AI help reduce stress or emotional fatigue caused by repeated denials and delays? I can take over that. So AI systems can auto check claims, pre-authorizations, and eligibility before submissions. This prevents denials caused by missing or incorrect data, and staff no longer have to spend hours reworking claims, which reduces burnout and frustration. For an example, AI tools in revenue cycle management flag incomplete documentation before submission, cutting down rework. Alrighty, let's wrap this up. And do we have any other questions before we do? I don't think so. Okay, so well, on behalf of Dr. Rahul, Vicky, and our team, I thank you all for being a part of this conversation. Let's continue transforming utilization management, making it smarter, faster, and truly patient-centered. Thank you so much, Dr. Dalvi and Vicky.
Thank you.
Thank you. Thank you very much, Bob. Thank you. Thank you, Dr. Rahul.
It was our pleasure. Thank you all.
Take care all. Bye-bye.